a condition so popular among runners that they named it after us. Let's talk about runner's knee. Runner's knee, or patellofemoral syndrome, is a condition where there's inflammation underneath the kneecap where it's tracking on the femur. Many different factors could have caused the symptoms to start up. It could be overpronation when you run, could be lack of good hip control when you're running, causing the knee to cave in a little bit. It could be some degenerative changes underneath the kneecap. If you're suffering from runner's knee, first we need to look back at your training history. Has anything changed? Are you running more miles or higher intensity? Have you added hills into your workouts? And then also just looking back into your other daily activities. Have you been doing more activities that require squatting or kneeling, or have you been doing a lot more stairs? Did you help a friend move? You know you can get out of that, right? I can't help right now. I'm videotaping a vlog. If you did identify some things in your daily life that might be making your symptoms worse, look at how you can modify those so that you can avoid squatting, kneeling, and stairs, or at least reduce how often you're doing that. Next, let's look at your training and see if we can spread out your running mileage, maybe take an extra day off so you're just running every other day, maybe reduce some of the intensity so that things can just settle down a little bit, and then we can start to work on fixing the problem. Next, we need to address the issues that might have left you vulnerable to develop the condition in the first place. We mentioned two big ones are overpronation and poor hip control. The good news is we can start to work on those things right now without making your symptoms any worse. This is Leanne. She's another one of our therapists at Indiana Physical Therapy, and she's agreed to help me out today. To help control overpronation, let's start with the muscles in the foot. You can work on gripping a towel with your toes. Make sure you're trying to keep your foot on the floor. Or you can work on using the toes to pick up marbles. Arch doming is another good exercise. We're going to try and keep the ball of the foot and the heel of the foot in contact with the ground while focusing on lifting the arch. There isn't much motion here, and it can be a frustrating exercise, but it's good at isolating the intrinsic foot musculature. Now let's look at the ankle. This basic exercise will start to strengthen the muscles that support the ankle during running. But this exercise isn't very functional. So when you can, I would progress to something a little more challenging. Here we're still working on the supporting muscles of the foot and ankle, but in a more functional position with our weight on the foot. I see more people with hip control issues than purely overpronation issues. The alignment of the hips and pelvis during running is controlled by the gluteus medius. So if we see hip dropping or the knee collapsing to the inside as you're running, then we're going to start with gluteus medius strengthening. Clamshells are a good place to start with gluteus medius strengthening. Make sure you're not rotating the back as you lift the knee. We can work on the neuromotor control necessary to hold the pelvis level by alternating leg extension in our bridge position. The goal of this exercise is to prevent the pelvis from rotating as you lift the leg. Now let's move to the standing position. This exercise mimics the responsibility of the gluteus medius during running. The knees stay straight, and you're going to focus on controlling the hip as it lowers down. The monster walk will also help isolate gluteus medius. You can place the band at the knees to help you focus on preventing the knee from collapsing to the inside, or you can place the band at the ankles for increased resistance. Now that we've addressed proper biomechanics, there's another really important thing to work on with patellofemoral syndrome, and that is the quadriceps. It's important that we gradually increase the load on the quadriceps so that it can start to handle the demands of running. We might have to start with a small range of motion or just some gentle strengthening, and then we can progress that as we get stronger. Long arc quads are not the most functional exercise, but they do isolate the quadriceps well. Depending on the severity of your symptoms, you may not tolerate this exercise. If it causes pain, then discontinue the exercise. Sometimes weight-bearing exercises are more tolerable. Here we're going to use the affected leg to step up onto the step as well as to lower us back down. You can start with a 4-inch step and then build the height from there to increase the demand, but stay in a relatively pain-free range. From there we can progress to a lateral step down, and again we're going to start with a 4-inch step and then progress up to a 6-inch step as pain subsides and our strength improves. Mild soreness is okay, but symptoms should not worsen during the exercise or after completion. As you get stronger and you can start to do more repetitions with less pain and less fatigue, then you can start to progress to various squat and lunge exercises. If symptoms aren't improving with self-management, then get in to see a professional sooner rather than later. You'll heal up more quickly and you'll be back out on the roads and the trails enjoying your running. That's all I got time for today. I gotta get back to work.